Hi everyone, this is Kristen Coombs with a whiteboard clip on the pathophysiology of the hypothalamus-pituitary-thyroid hormone axis. Before you delve into thyroid medications, it's important to have a good understanding of this negative feedback loop. First, thyroid hormones are pretty darn important to maintaining healthy metabolic processes and normal growth and maturation. They have an effect on many body tissues and bind to intracellular receptor complexes that promote the genetic expression of specific proteins. Thyroid hormones play a huge role in affecting cellular metabolism by altering protein, fat, and glucose, which leads to an increased production of heat and oxygen consumption. Okay, so how do we keep the thyroid hormone in check? Here's where the hypothalamus-pituitary-thyroid hormone axis comes into play. First, there's a stimulus. This arises when the body is cold or stressed and from decreased levels of T4, also known as thyroxine. The hypothalamus secretes TRH, which is thyrotropin-releasing hormone. TRH flows through the pituitary portal system and circulates to the anterior pituitary gland, where it stimulates the release of TSH, thyroid stimulating hormone. TSH then circulates and binds with specific receptor sites on the plasma membrane of the thyroid follicular cells, which have four major effects. First, TSH binding causes an immediate increase in the release of stored thyroid hormones. Second, there's an increase in the uptake and utilization of iodine. Third, there's an increase in the synthesis of T3, which is triiodothyronine, and T4, thyroxine. Lastly, there's an increase in the synthesis and secretion of prostaglandins by the thyroid gland. The secretion of the thyroid glands create a negative feedback loop and stops TRH and TSH secretion, and the process is started all over again when levels of T4 start to decrease or the body experiences extremes in stress or cold. Now let's take a look at conditions that can occur as a result of dysfunction of the thyroid gland or as a result of hypothalamic pituitary malfunction. In primary hyperthyroidism, there is an excess amount of TH and increased thyroid hormone levels, T4 and T3. With this, there is a corresponding decrease in TSH. Secondary hyperthyroidism is caused by TSH secreting tumors and is characterized by normal or increased TSH and high thyroid hormone concentrations. A radioactive iodine test helps delineate uptake and aid in diagnosis. Normal or elevated uptake of radioactive iodine is seen in Graves' disease, toxic multinodular goiter, and toxic adenomas. Low uptake signifies thyroiditis. Treatment involves controlling excessive TH production, secretion, or action with anti-thyroid drug therapy, radioactive iodine therapy, and/or surgery. The condition of hypothyroidism is related to primary and secondary causes as well. Primary hypothyroidism is most common. It occurs with the loss of functional thyroid tissue and leads to a decrease in production of TH. With this, there is a lack of negative feedback on pituitary TSH secretion and hypothalamic TRH secretion, leading to high levels of TSH and TRH and low levels of TH. Primary hypothyroidism is seen in autoimmune thyroiditis, also known as Hashimoto's disease, iatrogenic loss of thyroid tissue after surgical resection, or radioactive treatment for hyperthyroidism, head and neck radiation therapy, and medications or endemic iodine deficiency. Secondary hypothyroidism develops when the pituitary gland fails to synthesize adequate amounts of TSH or lack of TRH. This can be caused by pituitary tumors that compress pituitary cells, traumatic brain injury, subarachnoid hemorrhage, or pituitary infarction. Secondary hypothyroidism can also happen with dysfunction of the hypothalamus, leading to low levels of TRH, TSH, and TH. Treatment goals for hypothyroidism is metabolic restoration of symptoms and normalization of TSH levels in primary hypothyroidism, and normalization of TH levels in secondary hypothyroidism with use of synthetic hormone replacement therapy. Take a look at the extremes in clinical manifestations of hyperthyroidism and hypothyroidism. This picture illustrates opposing symptoms. Both conditions appear quite undesirable, and that's why treatment is so critical. Okay, now that you have a good comprehension of the hypothalamus-pituitary-thyroid axis, you are ready to grasp basic pharmacology in treating thyroid alterations. Thanks for watching this quick whiteboard clip. This is Kristen Coombs signing off.